All right, you guys, so if you're among those sniffling and sneezing or you're noticing eyes are itchy this week, there's a good chance you're among the many suffering from seasonal allergies.
That's right. The warmer weather and rain have kicked symptoms into overdrive for a lot of people, including me. Dr. Frank McGeorge is here with a closer look at what's going around.
Well, you know, Kim and DeMont, you can actually blame it on the trees because tree pollen is actually the primary culprit right now. It's been at high to moderate levels, and that is triggering a lot of allergy symptoms and secondary problems for allergy sufferers. Here's what's going around where you live.
In Wayne County, Dr. Asha Shahjahan at Corewell Health Beaumont and Grosse Pointe says patients continue to suffer from spring allergies and sinus infections. Doctors also report upper respiratory infections and stomach viruses. Checking on Oakland County, Trinity Health Oakland continues to treat patients with the flu and stomach viruses. Dr. Tim O'Neill at Clarkston Medical Group is also seeing stomach viruses and a touch of COVID. Dr. David Donaldson at Corewell Health Beaumont and Troy reports infectious illnesses are down there, but he's seeing a lot of kidney stones with the warmer weather and people not hydrating sufficiently. Looking at Washtenaw County, Dr. Brad Uren at Michigan Medicine says seasonal allergies are really kicking in this week, along with flare-ups of asthma and COPD. They're also seeing a bit of an uptick in COVID, plus a few other upper respiratory infections and stomach viruses. Heading to Monroe County, ProMedica Monroe Regional is seeing stomach virus symptoms and a number of falls. Doctors' offices say seasonal allergies are also an issue for lots of patients. Finally, in Macomb County, Dr. Richard Reedy at McLaren Macomb is treating several cases of late-in-the-season strep throat and some cases of pneumonia causing a deep cough, chest pain, and fever. Upper respiratory infections continue to be common, but flu is trending downward. Seasonal allergies are picking up as well.
Now, if you have seasonal allergies, be sure that you're taking your allergy medication as prescribed. And if you're using over-the-counter products, be sure that you're taking them consistently and as directed.
Sure. All right, talk a little bit more about some of the secondary problems you can see when people are suffering from a lot of allergy symptoms.
So there's actually a couple of things that kind of jump to mind. First is drowsiness, actually, from taking the wrong medications to treat your symptoms. If the product contains Benadryl or diphenhydramine, that's actually not a good long-term solution for allergies because of the sleepiness. Next, I would actually say sinus inflammation that's either painful or leads to an infection. So if you have allergies and you develop a localized headache, that's a time to talk to your doctor about possible sinus infection.
You know, I just learned something about the Benadryl. You have to administer it every 4 hours. There are lots of other allergy medications out there.
There's way better choices that are non-sedating, longer acting.
But I was old school. I only knew Benadryl, and I think my family probably gave it to me to make me sleep when I was little. Not the right thing to do.
Right,
but
I would avoid Benadryl.
So many more. Yeah,
definitely.
Better.
You know, one quick thing, and we've seen you and Hank go to the pharmacy to check on different medications. Is there any rule of thumb for people who may be experiencing some seasonal allergies to think about, especially if they're going to over-the-counters?
Well, I think definitely you should start with the non-sedating medications. That's kind of step one, because there are a ton of great antihistamines that do not put you to sleep. The other thing is if you have bad enough allergies, you also might want to consider nasal steroid sprays. And those are available over the counter now, and they can be used long-term. And I think those are both really good alternatives. But you should talk to your doctor if you're having severe symptoms. But if you have milder symptoms and you want to try something over the counter first, those are definitely places to start.
All right, Doc. Thanks.
Appreciate it.